So I'm Dan. I'm a ST5 ED registrar working in the Wessex Deanery at the moment. I think there's a lot of really useful applications that can be done in the emergency department, whether that's blocking the whole upper limb or even the forearm if you've got something like injuries or need to suture, if you've got fractures, dislocations you need to reduce. We do quite a lot of them at all different places on the body. So the fascia iliaca block is one that we have to do as part of our college. And also a lot of the rib ones are really important as well for people who get in with thoracic trauma or that might need things like chest drains. So loads and loads of great applications that can be used in the emergency department and a really good faculty and really good way of learning things. Yeah, absolutely got what I was hoping for and more. I was hoping to learn a bit more about all the different types of blocks. I've got that and a lot of practical applications as well, so lots of experience practicing on the models, obviously not putting needles into them, but getting to using the simulator for that and looking at all the anatomy with the ultrasound. So lots of hand-on practice as well as being directed by the faculty, so really good, yeah. Yeah, so a lot of the times we've been using actual people, so obviously that's the best simulator for patients that we have, so that's really great. Some of the simulators are really, really good as well. The needle finding one is incredible. I haven't used that before, I've seen that before, and I thought that was just fantastic. You can actually see where your needle would be in a real life patient without actually sticking a needle in someone that's well. Yeah, a lot more confident after today. Obviously it's something I want to develop a lot more and take back to my department and carry on with my professional development with. Yeah, I'd absolutely recommend this course to my colleagues. I'll be telling them that when I go back to work. It's a really, really good experience, a really good expert faculty, and I've learned an awful lot and want to take things forward even further.